Ticks are small brown bugs. They're about 3 to 5 millimeters with a bunch of little legs. They're tiny. And while ticks can be found in almost any state, they're most commonly found in the upper Midwest or the Northeast. So if you like to go hiking, walking in the woods or in tall grasses, you want to be aware of ticks because they can fall down like out of trees on your head, or they can climb up tall grasses and just hang out, called questing, for either an animal or a person to walk by to latch onto. And then if a tick does get on you, they tend to spend some time, up to a couple hours, finding an area of thin skin so that they can dig their head or snout into you. And their saliva contains anti-inflammatory factors so that it doesn't cause redness or pain at the site, so you often don't know you were bit, those sneaky little critters. They like thin areas of skin, they dig themselves in, and they feed off your blood, and they become engorged, and they can stay attached for days, weeks, until you find them. And then the problem with the bites is they can transmit disease to us or even animals, like Lyme disease or other co-infections like babesiosis, ehrlichiosis, Rocky Mountain spotted fever, quite a few, and they can cause really systemic inflammatory health problems to your joints, heart, central nervous system, and even be fatal, especially with Rocky Mountain spotted fever. Now, if you're bit and it was attached less than 24 hours, you're unlikely to get a disease from them. But if it's longer, especially 36 hours or longer, you want to consider getting a preventive dose of an antibiotic, preferably 200 milligrams of doxycycline, to lessen the chance that you're going to get Lyme disease. So now that you know about ticks and what they can do to you, how do you practice prevention? So if you like to go hiking and walking in the woods or even camping, you want to be aware of ticks. You can dress appropriately. It's great to wear a hat. That way at least the ticks don't just fall and get right in your scalp. It's good to wear long sleeves, long pants, tuck them in your shoes or boots. Rubber boots are great because ticks slide and have a hard time climbing up those. Light colors are great so you can see the ticks. And you can even spray yourself with a repellent. See my bug spray video, by the way. I like to avoid toxic chemicals like DEET, but you can make your own bug spray, and the essential oils that are particularly effective at repelling ticks would be tea tree, rose geranium, and there's one more, lemon eucalyptus. So now, all that being said, when you're out hiking and stuff, you want to look for ticks. Look on each other. Hopefully you're with someone throughout the day, or at least by the end of the day. If you can take your clothes off and shake them out, take a shower, that helps. And then you want to do a tick check. You always want to check your head, so you need someone else. They love your scalp, especially around the scalp line, but you have to check your whole head. They love behind your ears, again, thin skin. And then under your arms, around your genitals or butt, in your belly button, but you want to check everywhere. If you find one, you want to remove it immediately. So if you ever go traveling or camping, try to bring a pair of tweezers with you just in case. So you can use fine tip tweezers, or I have a medical hemostat. And if you find one, you want to grab it at the skin, as close to the skin as you can. You don't want to grab its body and squeeze, or it can squish its contents into you. So grab it at the tip and pull up very slowly and progressively, and hopefully the head just backs out. If it does break off and the head stays in you, it's not the end of the world. Keep it clean. You can try to dig it out. Your body tries to expel foreign bodies, so it'll hopefully come out. Then, if it was on you for quite a period of time, always beware after a tick bite. If you start developing any symptoms over days or up to a month, like aches, fever, if you just feel bad in general, but particularly if you develop a rash, about 75% of patients that develop Lyme disease will develop a specific rash called erythema migrans. It's at the tick bite site, and it's an expanding rash. It tends to be there for weeks, so hopefully you see it. And it looks like a bullseye. It's kind of clear in the center. So if you ever developed that rash or started feeling bad, please see your doctor. You want to get a full course of antibiotics, which is up to 3 weeks, usually of doxycycline, so that you don't end up with Lyme disease. And always remember that ticks also like animals, so always check your pets because they can get ticks and Lyme disease too. And lastly, there is a more rare type of tick called the Lone Star tick. They have a splotch on their back that's supposed to look like the Star of Texas. And not very common, but it can inject antibodies into you that gives you a lifelong red meat allergy. So, many reasons to be aware, knowledge is power, practice prevention from getting these pesky critters. Research shows that clicking the thumbs up and subscribe button will make fingers healthy and strong, and besides, it's free.